Buckle up and get ready to have some fun, but get ready to learn. This is the Dr. Tess 90210 Show. And here's your host, Tess Washington, MD.
Hello. Thank you so much for joining me. Well, I guess if I was a man and if I had to check out, I wouldn't mind checking out doing the hanky-panky. You know what I mean? Now, how does that happen? Excellent question. The heart is something that we absolutely cannot take for granted. But unfortunately, some of us do. And we also just brush off some of the signs when Mr. Heart is trying to say, I'm tired. Look, pay attention to me. Look at me. Pay attention to me. And we still are just eating our In-N-Out burgers and using our treadmill for a clothes rack. And Mr. Hart's like, okay. All right, you want to play it like that? We could play it like that. You're about to check out. So how is it that we can leave this earth prematurely? Secondary to Mr. Hart deciding that he no longer wants to play with us. Well, I put together a little video, and I feel like this video will give you a very clear depiction of how it happens. And the main thing to know is there is no one who is immune to this. We don't know. We have blood vessels all throughout our body, from the top of your head all the way down to your feet. And any one of those blood vessels could get a little clot or a little thrombus. If we have a clot that blocks the blood vessel in the circle of Willis, which is in our brain, boop, there goes that aneurysm. The worst headache of your life. If we have a clot that blocks one of our lower extremities, that's when you have a blood clot in your leg. Or how when you've been on an airplane and they say after 4 hours you want to get up, or if you're driving somewhere. So without further ado, let me go ahead and share with you the video I put together to show you how doing the hanky-panky sometimes can take you out of here. And did you know that the most common time that people experience a heart attack is first thing in the morning on Monday morning between 6 a.m. and noon? Do not ask me why. The literature basically kind of looks at the fact that we have a cortisol surge at about 2 or 3, give or take. And sometimes, you have the cortisol surge, and do you have the insulin reserve? Just a bunch of neurotransmission is going on as we sleep. That's when the growth hormone is activated if we go through all the stages of sleep. Now, while we're dealing with all of that with our inner body at night, then you get up, you're running late. And you're rushing and you're thinking about that presentation you got to do, and boop, you got the chest pain because a clot has been dislodged. So let me go ahead and run this good old bean footage. And after I get finished showing you guys the video, then I'll come back with additional commentary. Sex can kill you. Here's how. The functional capacity of the heart, or how much work can the heart take, is determined by a system called metabolic equivalence, or MET. The MET system is numbered 1 through 10, commonly used to clear you for surgery to determine if your heart can tolerate it. During sexual intercourse, it has been determined that the heart works at approximately a level of METs 4, especially during orgasm. So basically, the heart has something called functional capacity. Our lungs have the same thing. Functional capacity. And what does that mean? The capacity for them to function. The capacity for them to function normally before they start functioning at a pathological level. Now, let's say that you're going to the operating room and Joe hospitalist, I come in and I have to clear you for surgery. It's something called a risk stratification. Now, I'm going to stand there and I'm going to ask you a series of questions. How many flights of stairs can you go up? And some of you may be familiar with this mode of questioning because you may have been cleared for surgery before. Based on the answers to those questions, that allows us to know your metabolic equivalency. In other words, the functional capacity of your heart. Because Some surgical interventions are strenuous on your heart. It all depends on how long you have to be under anesthesia. The anesthesiologist needs to know so they can know how much medication we could give you. Based on the MET system, it goes from 1 through 10. And basically, sex pretty much hits around 3 or 4. So if you're just like me, I'm just sitting in this chair. So I'm functioning at about a level of METS 1. And if you're able to garden or if you're able to weed, like for example, if some people come in with signs and symptoms of CHF, they can't even garden. They get short of breath if they walk from their house to the mailbox. That's a good like METS 2 approximate. Or if you're getting dressed and you're just exhausted, by the time you get dressed, you need to take the clothes back off because you're so tired from getting dressed. You're hitting at about a METS 2 or 3. Sexual activity, especially at the time of the orgasm, is around METS 3 or 4. Taking a shower, you guys see the list. And this is available on Google and put in METS 4. In METS score, and then they give you the METS cardiac scoring system.
The left ventricle is the main hub that provides blood to the aorta, which goes all throughout your body. The heart is a muscle. It has to be provided blood. That's through the coronary arteries and veins. But let's say there's a blockage in the blood supply that goes to the left ventricle. No blockage, the blood flows nice and smooth, but let's say there's a blockage and it gets smaller and smaller. And this is through atherosclerotic plaque that has built in your vessels from our diet, all the cheeseburgers, In-N-Out burgers, and that plaque gets bigger and bigger and bigger, and that area gets smaller for the blood to flow through.
There is plenty of research that has shown some children have atherosclerotic plaques in childhood. And as they mature and they eat more and more of the Western diet or any diet that is considered to be high in saturated fat, high in cholesterol, it makes this plaque even larger. Now, here's the thing. Me, you, we could have this going on right now and we would have no idea. It would take something like an increase of requirement. Okay. So let me go back a little bit. All right. Where do I have this background? I have a master's in physiology and biophysics. I have a few publications and I work with Dr. Solero at University of Illinois. I had to know it in order to defend my thesis for me to graduate from my master's. So I hope that kind of like validates me to be sitting here. In addition to my medical degree and a bunch of other stuff I got on my wall, right? So basically, we have something that's called the Frank Starling Law. And that goes into the preload and the afterload and the diastolic and systolic function of the heart. I'm going to stop right there because I'm really, really trying to just keep this at a layman's level as much as possible. But I just wanted to show you guys how you can die from doing the hanky-panky. So if you have this much of an obstruction, take your finger and put your finger on the end of your water hose, okay, prior to your thumb. Prior to putting your thumb on the end of that water hose, the water was flowing nice and beautifully, just pouring out, unobstructed. But once you put your finger on the bottom, that's spraying, it's kind of like splattering, but it's not flowing in a nice flow to the point that it is not providing the necessary amount of perfusion. Okay, so that is what happens when we get a clot. Now, you take this hanky-panky, this sexual situation, and let's say you already have hypertension, that's high blood pressure, and you're taking medicine for that, and then you take one of those little blue pills because you want to make sure the woody is nice and woody. Now you got a vasodilator, and you already have taken something to lower your blood pressure, and in order for us to get an erection, it's not a bone, it's not a real bone, it's a bone-er. So all the blood has gone to Mr. Johnson to make him be able to give you a happy time. Now, where is that? So the reserve blood is down at Mr. Johnson. Well, what's going on with the heart? And you already got this little obstruction that you didn't know about. and then you get to a level of a METS 4, going back to functional capacity, you ain't got it. So this happens.
Let's say something happens like sex and a clot breaks off. That blood is stopped. No blood is moving anywhere, which means all the heart tissue is going to die because it can't get a blood supply. And this can come on all of a sudden. Let's say first thing in the morning, you're having coffee, then all of a sudden you feel a burning in your chest, a little nausea, I think it's a little indigestion within minutes, and you can't breathe. You try to stand, you try to cough, and next thing you know, bloop, you on the floor. Even though the heart attack may have came on all of a sudden, you were getting some symptoms probably 2 months prior, but they came and they went, they came and went. You didn't have time to go to the doctor. You hate doctors, remember? But there still is hope. If there's someone in the home with you, they're going to call 911. Those paramedics are going to get there right away. We want to get you to the cath lab in less than 30 minutes. And this is what happens. The paramedics take a picture of your heart called the EKG. That's sent to the heart doctor on call. As soon as you get to the hospital, you're going straight to the cardiac cath lab. Dye is entered in your veins so they can see exactly where that clot is. Once the spot has been determined, a angioplasty is performed, and that's when you put a stent in that opens up that area so that blood could once again flow freely. This is a depiction of it, and you see there's like a balloon that blows up to widen that area, and then the stent is placed. That feels a whole lot better, don't it? And there go the little platelets, la 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 la, flowing freely. And now, once again, you have blood throughout your body. The primary mode of prevention is with diet and exercise, but we can't pick our family. Sometimes you're born into a family that just got bad blood vessels. So when you go to the doctor, when they ask about your past family history, yeah, they talking about that uncle who died at 40 and the nephew who just died all of a sudden grabbing his chest and your dad who died. Tell them all that. It's important. They want to know because that gives them background information to know how to keep you here longer. So yes, sex can kill you. But then again, as you saw, you could just get up first thing in the morning and have a heart attack. Just please respect our mortality and know we were born for a reason. And the one thing that's promised, we will die. Enjoy your life.
The end. So I hope that gives you an idea of how sex, especially an orgasm, can kill you. Now, what is it that we can do to prevent it? Well, if it's hereditary and some families are born with just not bad blood vessels, but kind of blood vessels that are, not that healthy, you're a vascular path and, you can't pick your family. So, but we don't know. None of us know, right? So all we can do is control the things that are within our control. Our diet, eat healthy. There are some foods that are preferred as far as cardiac health. The American Heart Association has a slew of information. And if you want me to, absolutely, I have no problem putting some references in a description box. Hydration is imperative. We have to drink. I tell my followers to drink at least 3 liters of water per day. Now, you want to talk to your doctor. I'm not giving any medical advice, okay? You want to go to your doctor and you want to make sure you get cleared. All this information. Take my video. Tell your doctor to subscribe. As a matter of fact, if you like this kind of content, do me a favor. Subscribe to the channel. And I'll be more than happy to make a video that caters to any kind of medical concerns you have. Because the main reason I made this video is just because it's the Kevin Samuel situation that happened so recently, and everyone's having a hard time. They feel like he looks like he was in shape, and he probably was. He could have been ready for the Iron Man, but that doesn't have anything to do with a clot that he maybe didn't know anything about. All right, so, when it's time for us to go, we all got an expiration tag on our foot, right? We just can't see it. So I just wanted to bring this into the picture. Now, was he drinking the Red Bull? Yeah, but Red Bull isn't going to, was about 200 milligrams of caffeine. Now, I can't say it's the healthiest thing to do, and it may cause you to have a dysrhythmia, but it's not going to cause you. if you notice from the article that was in that trending magazine, the young lady said he was on top of her and he fell on her. There's a good possibility he was in the process of a orgasm, and that put him into Meds 4. And we don't know. He may have taken, I don't know. He may have taken a little blue pill. Who knows? But I just wanted to just bring this to light. The control that we have on this whole situation is our diet and our exercise and our level of stress. You have to respect the fact that you are in a state of stress right now, post-pandemic, and just everything that's going on in the world. Your circadian rhythm is just off. You have to calm down, step away from situations, avoid argument. You see a lot of traffic, just take the side street. It may take you a little bit longer, but it's a lot less stressful. And just respect your mortality. So I hope that you guys got something out of this, and just know, yes, heart attacks could occur first thing in the morning. They could occur during sex. What about people who die on a treadmill? It was some celebrity, I forgot, just croaked over on the treadmill, or there are airline pilots that have died at 38,000 feet in the air in total control of the airplane, had a heart attack. People die in traffic all the time. It happens. Treat your heart nice, and your heart will return the favor. I'm Tess Washington, MD. Thank you so much for stopping by Tess MD TV. And as stated, subscribe, like, share, tell your friends, and come on back here if you want to hear about some more information that can keep you healthy and hopefully keep you on this earth just a little bit longer. Take care.
We hope you've gotten some useful and practical information from the show. Make sure to like, rate, and review, and we'll be back soon. But in the meantime, hook up with Dr. Tess on Twitter, Instagram, TikTok, and LinkedIn at Dr. Tess 90210. See you next time.